Did you know that sugar kills more people every year than guns, wars, or car crashes combined? It's hiding in your morning cereal, your coffee, your healthy yogurt, and even in the bread you think is good for you. We are, quite literally, eating ourselves sick. Hello and welcome. Today we're diving into one of the biggest public health battles of our time, the war against sugar. In this video, we'll uncover how an ingredient that once symbolized luxury and happiness has quietly become one of the leading drivers of disease worldwide. From obesity to heart disease, from diabetes to liver failure, sugar sits at the center of a modern health crisis that governments, scientists, and even the food industry are struggling to contain. Yet the story of sugar isn't just about what we eat. It's about how the world we live in makes us eat. So, why is sugar so addictive? How did it become so deeply woven into our economy, our culture, and even our childhood memories? And what can public health do to fight back? That's what we're about to explore, the sweet poison shaping the future of human health. Before we go deeper, let's start with a simple question. What exactly is sugar? In nutrition, sugar refers to simple carbohydrates that provide energy for the body. Naturally occurring sugars, like those found in fruits and milk, are not the real villains here. The problem lies in added sugars, the ones that are industrially refined and poured into nearly every processed food we eat. According to the World Health Organization, added sugars are all sugars added to foods and drinks by the manufacturer, cook, or consumer, and they recommend that less than 10% of your total daily energy intake should come from them. But in most countries, people consume 2 to 3 times that amount. The modern diet is saturated with hidden sugar in ketchup, salad dressings, canned soups, and even bread. It's not just what we taste, it's what we don't notice. These invisible calories create a constant flood of glucose that overwhelms our metabolism, leading to insulin resistance, inflammation, and a slow collapse of the body's regulatory systems. But the real story of sugar goes beyond biology. It's economic, political, and psychological. The food industry discovered decades ago that sugar isn't just sweet, it's addictive. It lights up the brain's reward centers like a drug, triggering dopamine releases that make us crave more. In other words, sugar doesn't just satisfy hunger. It shapes behavior. It manipulates choice. It keeps consumers coming back for another bite, another sip, another sale. And that's where public health steps in, not just to educate, but to regulate. Because when addiction hides inside a sandwich or soda can, individual willpower alone isn't enough. Every year, more than 11 million people die from diet-related diseases, and sugar is a key culprit behind that staggering number. The World Health Organization lists excessive sugar consumption as one of the major risk factors driving the global rise in obesity, heart disease, type 2 diabetes, and certain cancers. Think about this. In 1960, type 2 diabetes was rare. Today, over 500 million people worldwide live with it. It's not simply that we're eating more, it's that we're eating differently. Cheap, ultra-processed foods, filled with hidden sugars, have become the foundation of modern diets, especially in urban and low-income communities. A can of soda contains around 10 teaspoons of sugar, more than what your body needs in an entire day. Drink one daily for a year, and that adds up to over 14 kilograms of pure sugar. The damage doesn't stop at weight gain. Excess sugar increases triglycerides, clogs arteries, overloads the liver, and fuels chronic inflammation, the silent spark behind countless modern diseases. But this epidemic isn't just a matter of individual choice, it's a structural issue, shaped by economics and policy. For decades, the global food industry has perfected the art of selling sweetness. It's cheap, addictive, and profitable. Companies design products to hit the bliss point, the exact level of sweetness that keeps people hooked without realizing it. Meanwhile, aggressive marketing targets children through colorful packaging, cartoon mascots, and sugary breakfast cereals disguised as healthy options. It's no accident that the average child today consumes more sugar before breakfast than their grandparents did in an entire day. Public health experts call it the toxic food environment, a world where the cheapest and most accessible foods are also the most harmful. And while awareness is growing, the economic power behind sugar remains immense. Which raises the question, if this problem is so clear, why hasn't it been solved? To understand how sugar became a public health crisis, we have to look at the system that feeds it, literally and figuratively. At its core, this epidemic sits at the intersection of biology, economy, and policy. On the biological side, our bodies evolved in a world of scarcity. Sweetness once meant energy and survival, but in today's industrial food system, that survival mechanism has turned against us. Every sip of soda or spoonful of processed cereal triggers the brain's reward circuit, flooding it with dopamine, the same chemical released by drugs like cocaine. The pleasure fades quickly, but the craving stays, trapping millions in a cycle of dependence. Economically, sugar is a dream ingredient. It's cheap, extends shelf life, and makes almost anything taste better. From sauces to bread, from baby food to energy drinks, sugar sells. The global sugar industry is worth over $60 billion, with a lobbying force that has historically rivaled big tobacco. In the 1970s, when early research began linking sugar to heart disease, industry groups quietly funded studies that shifted the blame toward fat. The result was decades of low-fat products that ironically contained more sugar than ever before. From a public health perspective, this manipulation delayed action, and the consequences are devastating. Entire populations, especially in developing countries, are now suffering the second wave of the sugar epidemic. As Western diets spread globally, so do the diseases once seen as diseases of affluence. Public health professionals categorize the response to sugar across three main fronts. 1. Education, campaigns to raise awareness about added sugars in processed foods. 2. Regulation, introducing sugar taxes, labeling requirements, and marketing restrictions. 3. Environmental reform, creating healthier food environments by changing what's available, affordable, and desirable. For instance, countries like Mexico, the UK, and the Philippines have implemented sugar taxes on soft drinks, and early data shows promising results. Mexico's soda tax led to a 12% reduction in sugary drink sales within the first year. The UK's levy pushed beverage companies to reformulate their products with less sugar. But resistance remains fierce. Food giants argue that taxation punishes consumers and hurts business. Yet the reality is clear. The health costs of inaction far outweigh short-term profits. This is not a war between consumers and corporations. It's a fight over who controls our food, our health, and ultimately our future. At first glance, it's easy to think this is a matter of willpower, that people just need to eat less sugar. But public health teaches us that health is not only about personal decisions. It's about the environment that shapes those decisions. Consider two perspectives. From the individual point of view, choosing to cut sugar sounds simple. Read the label, skip dessert, drink water instead of soda. But from the public health point of view, the picture is much broader. It asks, why are sugary products so cheap, so visible, and so aggressively advertised, while fresh food remains expensive and hard to find in many neighborhoods? This is where public health diverges sharply from clinical medicine. A doctor treats a patient after the disease appears. A public health expert tries to prevent the disease before it starts. Not by changing one person's habits, but by changing the environment that makes unhealthy habits the norm. Take an example. A man is diagnosed with type 2 diabetes after years of drinking soda daily. A clinician might prescribe medication and dietary counseling. A public health approach would ask, why was soda the easiest and cheapest drink available? Why was he bombarded by advertisements since childhood? Why did his school cafeteria serve sugary drinks instead of water? This difference matters because no amount of individual effort can fully counteract a system designed to profit from overconsumption. Public health shifts the conversation from blame to responsibility. It holds industries and governments accountable for the conditions that produce disease, the pricing, the marketing, the availability. So, the fight against sugar isn't about shaming consumers. It's about empowering them. It is about creating environments where the healthier choice becomes the easier choice, not the privilege of a few, but the default for everyone. And that's where the next step begins, transforming awareness into action, policy, and measurable change. Because knowing the problem isn't enough, the question is, how do we fix it? Around the world, the war on sugar is gaining ground. Governments, researchers, and activists are now treating sugar not as a harmless indulgence, but as a public health threat on the scale of tobacco. One of the strongest weapons in this battle is policy. The idea is simple but powerful. Make the unhealthy choice less appealing, and the healthy one more accessible. The sugar tax is one of the most successful examples. In 2014, Mexico became one of the first countries to impose a tax on sugary drinks. Within a year, consumption dropped by more than 12%, while water sales increased. Other nations followed: the United Kingdom, Chile, South Africa, Thailand, and the Philippines all implemented similar policies with measurable impact. Meanwhile, labeling laws have evolved. Chile now requires bright black warning labels on sugary products, stating high in sugar. The result? Parents began avoiding high-sugar snacks, and food companies started reformulating products to avoid the label altogether. In the United States, nutrition panels now list added sugars separately to make them visible to consumers, a small but crucial step toward transparency. At the community level, schools are banning sodas, cities are restricting junk food advertising, and campaigns are reframing the narrative from sugar equals happiness to sugar equals harm. Public health groups are also pushing for better access to fresh, affordable produce in urban food deserts, where processed snacks once dominated. But the fight doesn't end with government action. It extends to corporate accountability. Many multinational food companies have begun cutting sugar from their products, not out of goodwill, but because consumer awareness is shifting. People are reading labels, demanding change, and choosing alternatives. Technology and education are becoming powerful allies. Digital tools like calorie tracking apps, AI-driven diet planners, and social media campaigns are turning knowledge into daily habits. The message is spreading. Moderation isn't enough. Systemic change is needed. Still, every victory faces pushback. The sugar industry continues to lobby, fund misleading studies, and rebrand itself through health washing, marketing products as natural, organic, or low-fat, while keeping sugar high. Public health experts know this battle won't be won overnight. It will take political courage, cultural shifts, and global collaboration. But one fact is undeniable. Every gram of sugar reduced at the population level means fewer cases of diabetes, fewer heart attacks, fewer lives cut short. The war on sugar is no longer about taste. It's about survival. So what have we learned from this story? The story of how sweetness turned toxic. First, sugar isn't just a dietary issue. It's a systemic one. It hides in almost every processed food, pushed by powerful industries that profit from addiction. What began as a harmless pleasure has become one of the world's most preventable killers. Second, our biology is working against us. Humans are hardwired to crave sweetness, but modern food systems exploit that instinct. The result is a constant, silent overdose, one that drives obesity, diabetes, heart disease, and even cancer. Third, personal choice alone isn't enough. The environment we live in, our supermarkets, advertisements, pricing policies, and social norms all push us toward unhealthy consumption. Without structural change, even the most disciplined individual will struggle to escape the sugar trap. Fourth, public health has the tools to fight back. Education, taxation, labeling, and regulation have already shown measurable success. Countries that act boldly are seeing real progress. Fewer sugary drinks consumed, fewer children hooked on sweetened foods, and more awareness spreading across generations. And finally, this is a fight we can win. Not by fear or blame, but by knowledge and collective action. The path forward isn't about removing all sweetness from life, it's about reclaiming control over it. So yes, sugar is everywhere. But understanding how it shapes our health, our economy, and our future is the first step toward change. The war against sugar isn't about taking away joy. It's about protecting it. Because only in a healthier world can sweetness truly mean happiness. If this video made you look twice at that healthy snack in your hand, you're not alone. The truth is, sugar hides in plain sight, in the products we trust, the ads we enjoy, and the habits we never question. But knowledge is power. And every small choice, reading a label, skipping a soda, questioning what's on your plate, adds up to something bigger. Public health begins not in hospitals, but in homes, schools, and grocery stores. It begins when awareness turns into action, when we demand transparency, support smart policies, and build environments where healthy food isn't a privilege, but a norm. So next time you see that glittering can of soda or that low-fat snack bar, remember sweetness has a price, and it's not just measured in calories. If you found this video useful, don't forget to subscribe. Your curiosity keeps these conversations alive, and together we can turn awareness into change. In the next video, we'll explore the silent epidemic, why non-communicable diseases kill 40 million people a year, and how these diseases are reshaping the future of global health. Until then, stay curious, stay critical, and take care of your health, one mindful choice at a time.